Hi, this is Dr. Sam Collins for the American Acupuncture Council with one of our series on coding and billing, and it's my pleasure to be with you today. I'm the director of our insurance network at the American Acupuncture Council that does all the coding and billing issues for seminars as well as for the malpractice insurance. Today's program is going to be understanding how do we bill or understand for counseling. There's a lot of angst in the profession as to whether it's something we can code for or how do we code it. And so I want to make sure that there's a reasonable understanding for when is it appropriate to bill and code for it, when is it included as part of the service. So before we really get into what the coding is, we have to really make an understanding of what counseling is. So we want to take some time to really get an understanding of what type of coding we need to use, but let's first really talk about what the commitment is of our company to you. Our goal and commitment is to strengthen and grow the acupuncture profession by providing education, tools, and support that continually improve the productivity, profitability, and well-being of the alternative health community as a whole, but obviously for acupuncture. And for your acupuncturists, often you're not aware or not having a good understanding of what services you can code for. So today, let's really tackle counseling and what it really means. So let's define counseling. Counseling involves really a discussion with the patient and or the family about one of the following things, really. If you think of it, just simple diagnostic tests and impressions and recommended services. So at the end of your exam, you may discuss with the patient about, here's what we want to do with you. We're going to provide acupuncture, maybe talk about their diet. That's part of that counseling. It includes the prognosis, telling the patient what your expectations are. What are the risks and benefits of the treatment options? You know, we're going to do acupuncture, maybe they're going to do some herbals and so forth, but getting them a good understanding of that. Again, discussion. Instructions for treatment, telling them what you're going to do with treatment, what their expectations should be, what you're going to follow up with. And of course, the importance of compliance with the chosen treatment options, as well as risk factor reductions. Things could be diet, lifestyle, sleep, supplements, and or just patient and family education. So bear in mind, counseling includes kind of what you think of. It's counseling, that discussion with the patient about their overall health, the care plan, and what's going on with them. The difficulty here, though, is that often people hear this term counseling and they confuse it with a service in CPT that's called consultation. Counseling is part of an evaluation and management. Consultation, however, is not. And what you want to make sure is do not confuse this with counseling. Counseling, again, is what we just mentioned, but let's define consultation, because if you think of consultation from a Webster dictionary standpoint, it sounds like what we just discussed, but in fact, it's not. Consultation, as defined by the CPT manual, is the evaluation and management service provided at the request of another physician or an appropriate source. So the real difference here, consultation really is not counseling the patient. Consultation is really a referral from another provider or maybe an insurance company to give a specific second opinion. And it says, or to determine whether to accept responsibility for ongoing management of the patient's entire care or care of a specific problem. In other words, a consultation is really a second opinion. So don't confuse this with counseling your patient. That is just part of your overall care. So again, you may see codes that say consultation. You should never use those. Those codes would be 99241 through 99245 and would be coded when another provider has sent you a patient for a second opinion, not necessarily someone to treat. Counseling, though, is included in a service that we commonly bill, and this is where I think the confusion comes in. I'm assuming most of you out there are familiar with evaluation and management codes, often referred to as E&M services. These are the codes we commonly use for examinations. So meaning the patient comes in for the first time, we examine them in order to determine their problem, create a diagnosis and a treatment plan. Obviously, we have two types of codes. The one you see here on the screen says new patient. These codes go 99201 through 99205. And they're simply from a very limited small exam to a high level exam. Let's make sure there's a good understanding of these codes. Of course, a new patient code is just what it sounds like. Notice at the top it says a new patient is one who has not received any professional services. So in other words, they're brand new. But if you notice at the last part of this sentence, it says within the past 3 years. So the difference here is you may bill a new patient, obviously, if the patient is brand new, but you may also bill one if they've not been seen in 3 years or greater. Realize this includes counseling. Most people don't understand that part of it, but I want to make sure we define it. Of course, it's for an exam, but there's an inclusion of counseling along with it. In addition to the new patient codes, we have established patient codes. The established patient codes are very similar, 99211 through 99215. So they kind of follow the same pattern. The only difference here is, notice the definition. An established patient is one who has received any professional services from a physician or another physician within the same specialty for a re-exam or even a new condition. So bear in mind, if you saw a patient 6 months ago for headaches and they return today because of back pain, you're going to bill an established patient. Even though it's a new condition, it's still a patient you've seen within 3 years. So the whole choice of these codes are not dependent upon new injuries and new complaints, but just the time limit of when you've seen the patient. One thing to bear in mind, though, for those of you out there who practice in a multidiscipline office, let's say you're practicing with a chiropractor or a medical doctor. If the medical doctor or chiropractor were to see this patient, and then you later see this patient, you may bill a new patient simply because you're of a different specialty. Again, just because that other provider is seeing them doesn't change it for you. Now, if you're practicing with another acupuncturist, you're of the same specialty, then even though you are new to the patient, because they've been seen in your practice with another provider of same specialty, you may only bill an established patient. And you notice these codes fit that same protocol from a very limited or minimal to a comprehensive. The difficulty here is, well, where does counseling fit in this? Well, let's take a look at evaluation management and actually what it includes. The evaluation and management codes, of course, 99201 to 205 for new patient and 99211 to 215 for established patient, have 7 main components. You'll see the ones highlighted up here in blue say history, examination, medical decision making. Those are considered the main components for the level of exam chosen. For instance, the patient presents with a severe low back problem, but maybe a little bit of difficulty with bowel movements and numbness and tingling in the leg. Based on that type of presenting problem, you're going to do a much more significant history on that patient than you might otherwise, a more detailed exam. So in other words, kind of the nature of the problem will present itself and make you do a little bit more history. Because of that history and severity, maybe the examinations of higher. So bear in mind the top 3 are the main factors of choosing. But one of the factors that are one of the main components, not as top as the first 3, it is this counseling. So you notice counseling here, I'll highlight and I'll have it spin a little bit to say counseling is part of an evaluation management. So when you're thinking of how do I code for counseling, the first thing you have to think of, counseling is an evaluation and management code. And therefore, if you're going to code for counseling, you actually are going to use an E&M code for it. But let's make sure, how do we use this counseling? Since it's not a major component like history, exam, or medical decision making, where does it fit? Well, you may think at the bottom, oh, time. Well, time is part of it, but we want to be careful. You can't just say I spent an hour and so I get to bill a 205, but the counseling part has a special component to it. So E&M is defining it this way, CPT manual defines it this way, and here's how it works. Counseling time for an E&M, and this is a very specific component. When counseling or coordination of care dominates more than 50% of the encounter with the patient or their family face-to-face, the time shall be the key controlling factor. So in other words, if you have a visit where counseling the patient is the really controlling time, you may bill an E&M for that counseling time. So let's say, for instance, you do a half an hour of acupuncture, say 2 sets, and you spend another 30 minutes or more counseling the patient. It is then you can bill for the counseling of it. Realize that anything under that would not be included as a separate code because the acupuncture code actually includes a little bit of counseling time. But think of this when it goes above and beyond. Maybe you spend 20 minutes on treatment with the patient, but now they come in and they've got lots of questions or other issues, and you spend 40 minutes face-to-face just counseling them on that on top of the acupuncture, then it is certainly reasonable. So it's very important to remember counseling is an E&M service, but only when the time represents more than 50% of the entire encounter. So if the encounter is 1 hour, at least 30 minutes or more must be spent just on counseling alone. So for instance, what if you did 3 sets of acupuncture? You spent 45 minutes with 3 insertions, and you spent an additional 15 minutes counseling. That counseling would be included in the acupuncture service, not separately billed, because 15 minutes based on 1 hour does not meet the 50% limit. So let's talk about the acupuncture itself to make sure there's a good understanding of when this counseling is going to be appropriate, because now you can see there's going to be a 50% component that's required for counseling. Certainly it's important that you can code for it, but we got to make sure it's appropriate. Let's talk about acupuncture. What does acupuncture include? When you do acupuncture, The reason you use the 25 modifier, and I'm assuming most of you are aware, the 25 modifier is the modifier we put on an E&M code when billed with treatment to show that the exam is above and beyond what's associated with the acupuncture. So let's talk about what is associated with acupuncture. First thing we have is what's called the pre-service time of acupuncture. This includes assessment and management time, medical record review, physician or acupuncture contact while the patient is present, an assessment of the patient's progress since the previous visit, and time required to establish clinical judgment for the treatment session. What's important is that the pre-service time is not the time required to get the patient ready to receive treatment. So in other words, putting the patient in the room and saying put on a gown, that time doesn't count. To make it hopefully a little bit simpler, this pre-service really is, if you think of it, a simple review of the patient's record. You know how before you treat the patient, they come in and you take a look at the record to see, oh, let's see what we did last time. How is the patient responding? And then you're going to do a review of the chief complaint. In other words, you're going to ask, how are you feeling today? You're going to communicate with other providers, maybe, but you're also going to get prepped for care. In other words, what you're doing here is a short little history. When a patient comes in, you don't simply tell them to lie on the table and start inserting needles, but you spend a little time reviewing their history. How are you feeling today? What's changed? Anything worse? That's the pre-service. Then, of course, there's an intra-service. The service itself, this is the hands-on treatment time. So this is doing the actual acupuncture, okay? Putting the needles in, make sure you have good grasp and all those things. To hopefully bring that more full circle, think of it this way. Intra-service includes discussion. Maybe you're going to include some points you haven't before. Maybe you're going to do a little evaluation of the patient, maybe some tongue and pulse. The performance of the acupuncture service includes all the things such as hand washing, cleaning the points, inserting the needles. Maybe you come back, you stimulate the needles. What it also includes is removal of the needles and actually disposal. It can also include the monitoring of a procedure. So when you're in the room with the patient, spending some time making sure maybe their skin is becoming flush or making sure they're not having any other ill feelings, that time would be included. It would also include if you spend any time stimulating the needles. Notice at the bottom here, it says retention without direct face-to-face time does not count towards the time for billing of acupuncture. So there is a pre-service, how are you feeling today, an intra-service assessment and the actual acupuncture, and a little post-service. Now it's important here to note the post-service because this is what really fits for our counseling. Post-service time includes the assessment of the treatment effectiveness. In other words, you remove the needles, patient sits up, make sure that they're comfortable. Of course, also communication with the patient or caregiver. And notice here how important it states, patient or caregiver to include education, instruction, notice counseling, advising, professional communications, and then clinical judgment for planning the next treatment session. Also includes a note at the bottom, documentation. I want to go back here and note there's a little bit of counseling included in the acupuncture. So your day-to-day simple counseling is really just part of the acupuncture. Let's say you spend about a half hour with the patient. You spend 10 minutes going over maybe some dietary changes. That would not include or be coded separately as counseling because it doesn't meet that 50% threshold. So the post-service, evaluation of the patient, discussion of treatment effectiveness, documenting the service, and arrangement of further care if needed for referral. For the most part, it's really just going to be your post-service, let's have you come back again. So one of the things to keep in mind here is that, can you bill for counseling? You can, but the counseling has to meet the 50%. So do look at your time when you're with the patient. If you're doing a half-hour treatment and 10 minutes of counseling, it does not count. But if you're doing a half hour of treatment and then spending another 30 minutes counseling, then it would, because it meets that 50% threshold. Let's kind of get into the details though. Of obviously, there are times that you're going to bill for exams in deference to when there's treatment. And let's make sure there's 10 factors of where you're going to bill this, and one of them is going to include counseling. So let's kind of get into that a little bit. For exam or office visit, and when I say exam, I'm talking about the actual exam of the patient, the total E&M. Obviously, the initial visit requires an examination, so it is completely appropriate for you to bill on the first visit an initial exam, E&M code, whether in a new patient or established. That makes sense. Think of it this way. You cannot treat a patient without evaluating them. It wouldn't make much sense to say, I don't care what's wrong with you, let's just insert needles. You're certainly going to say, what's the chief complaint? And then, of course, based on that complaint, evaluate areas to determine the course of care. So that completely makes sense. So obviously, on the first visit, you're going to do an exam, and it may include counseling. But remember, could you bill for counseling above and beyond? Only if it meets the 50% threshold. Clearly, another time to bill an office visit or an E&M code is about every 30 days. Now, that can be sooner in some instances, but certainly based on CMS, Department of Health Services, it's pretty common under any guideline that acupuncturists, almost any healthcare provider, where a patient is receiving ongoing care, to at least every 30 days evaluate this patient. Another thing that a change or a way to think of doing another exam is, what if the patient comes in on a Monday and they're stating to you, hey, my headaches are much better, but all of a sudden I had some pain shooting into my neck. Notice, significant change in condition could warrant it as well. Let's say a person comes on a Monday with headaches only, but then comes on the next day saying, hey, there's something radiating to my neck. That certainly could be a reason for billing, of course, another E&M. Obviously, another and most obvious one probably is just a new complaint. I come in on a Monday complaining of headaches, but then on Friday the patient's in and saying, hey, doc, my headaches are much better, but now my low back is killing me. Well, that completely makes sense to me that you would do an evaluation, because the evaluation you did for the first visit, their headaches, has very little to do with, or at least has other factors for the low back that you may need to evaluate. So again, another time where you bill an E&M. Another, of course, and this one you want to be careful of. Notice it says return for ROF of diagnostic tests. ROF stands for report of findings. Now, be careful. Notice the intra, pre, and post service includes a report of findings. So notice this very specifically says return for a report of findings of diagnostic tests. So think of it this way, probably in an acupuncture setting, maybe the patient had some lab work or some other services done outside your office where you get this information. Now, once you have this information, you spend time with the patient going over these tests. Then again, can you bill for an office visit? You can. And when I say office visit, again, I want to go back to state E&M code. But remember, does it still have to meet the 50% threshold? So again, we'll go back to, let's say you do 30 minutes of acupuncture and you spend 10 or 15 minutes going over report of findings for outside labs. Again, it does not fit. So be conscientious of always thinking of, can I bill for counseling? Can I bill for another exam? Sure, but does it fit initial every 30 days, new complaint, or counseling at the 50% threshold? Obviously, if you're going to refer the patient out, that may require an evaluation to determine what's going on. But here's the one that's really what we're dealing with today, counseling. Remember, counseling is a reason that you could bill an evaluation management, much more frequent, simply because the patient may have other issues. But remember the 50% rule. So again, always look at your time. If you were spending 30 minutes and only 10 doesn't count, not until they're equal or more. And it's not unreasonable, because you often will have a patient that comes in, and it's certainly not every visit, but on some visits where they have a lot of questions or they have a lot of issues they want to discuss with you, because maybe they're deciding to take some vitamins or herbs that you're all of a sudden want to look at to make sure, is this going to be any contraindication for what's going on with them? What if they're taking any medication? That clearly is going to be some counseling time you need to spend, and of course is billable if it meets the 50% threshold. Obviously, a few others. If you have a patient that's on disability, that potentially could be something that if they're going to go back to work, you're going to evaluate them to whether they can return. That doesn't happen often for an acupuncturist, because most acupuncturists don't do a lot of disability, but it's certainly possible. Another, of course, is a deviation of treatment protocol. So I'm not sure the big issue here for a deviation of treatment protocol, because I'm not sure, does that mean I'm going to do 4 sets of needles instead of 3? But at the same token, is certainly possible. The other is that you could certainly think of is just a dismissal. When you release a patient, obviously you're going to spend time with them, I assume, on the final visit, not only evaluating them to see that they have resolved or have made the expectations you had, but maybe you're going to spend some time discussing with them at length things you want them to do to prevent this from happening again, or at least to promote a better healthy lifestyle. So for instance, you may be discussing with them about sleep habits, diet, exercise, their postural habits, you name it, any of these factors on the final visit, again, so long as that timing meets above and beyond the service you provided. Let's say on the final visit, you didn't do any acupuncture at all, then certainly an E&M would be appropriate, because obviously the visit was dominated by counseling. So bear in mind, let's go back to what is the counseling code? Because you're still probably thinking, what do you mean by counseling code? The counseling code is not a direct code for counseling, but counseling is a component of an evaluation and management. So remember, whenever you bill an exam or an evaluation and management, it does require a special modifier. So even though this is very basic, I'm going to make sure you can see it. Take a look right here. You notice on this patient, 99203, which is an evaluation and management service, has next to it modifier 25. This 25 indicates and tells the insurance that this evaluation, 99203, was above and beyond the pre, intra, and post-service evaluation associated with 97810. In other words, above and beyond the typical for acupuncture. Remember, acupuncture includes a small evaluation. Therefore, when it's above and beyond, we have to demonstrate that by putting not only the E&M code, but the 25. Let's say, for instance, this example shows a patient coming in on January 2nd and January 5th. Let's say on January 5th, this patient had some additional counseling. Could we add, say, a 99213 or a 99212, depending on the time, to this? You could. You would just simply have to code 99212 with a 25 modifier in addition to the services billed here. Very important when you're billing E&M codes often, because insurance companies often will expect that it's about every 30 days, but it certainly can be more often depending on the situation. We want to make sure that if they ever question why you billed it, it's going to be obvious. So please make sure, as far as documentation is concerned, always document in the record the total time of the visit. Obviously, you as an acupuncturist do have to code for your acupuncture services and everything else that you do. Therefore, acupuncture being a time service, it makes sense that you would document the time. Here was the first set. I spent 15 minutes with the following points. Here's the second set for 15 minutes. So you're going to have that total time. But if you are looking at the total time for the visit, that should also be there if you're going to bill for counseling. So please make sure, document here where it says the actual time spent counseling. The time is the actual face-to-face time with the patient, not necessarily the total time of the visit here, but what was discussed. In other words, was it about diet? Was it about questions? And you certainly do not have to document a verbatim issue with the patient on every single item, but an overview of what was discussed in your conclusions or recommendations. If there are any pamphlets, anything like that you gave the patient, make sure that there's copies in there. The important thing here is that it makes sense. When you spend more time with the patient, might there be higher billing for it? And my rule is, yes, there is. If you were to get 15 minutes of massage, that would be a price. If you get an hour of massage, it will be more. Same applies with acupuncture. If you get one set of 15 minutes, it's one price, 30 minutes another. But I also would throw in there the counseling. If you're spending an hour with the patient and you're counseling, so long as the hour is dominated by the counseling, that is another way to code it. Because I would hate for an acupuncturist to spend and do maybe 1 or 2 sets of acupuncture, but the total time face-to-face with the patient is an hour. I don't think that's fair to you that you get paid a lesser amount. Now, some of you may be wondering, saying, well, wait a minute. Some insurance companies don't like to pay for exams or don't pay for counseling. And to that, I will say, no, they cannot. In fact, under the so-called Affordable Care Act, or probably more appropriately called the Patient Protection Affordable Care Act, there's a non-discrimination section. Now, whether or not we agree with everything about this law, we won't get into that. But this part, I think, is fair, and it's fair to patients as well, and it's this. In this law, there's a section 2706 that says scope of practice has to be protected by any provider. In other words, as an acupuncturist, an insurance company cannot discriminate against you for services within scope. So if you think of it, the things that you can do as an acupuncturist go beyond just providing acupuncture. Certainly that's the major part. But think of things like evaluation and management, physical medicine and rehabilitation, or so many of us think of it as PT, even nutrition or counseling. So let's really take a look at this law so that when you are billing this and an insurance attempts to deny you, I'm going to say to you, absolutely not, because it's reasonable for you to bill for it just as any other provider, whether they're a chiropractor, medical doctor, or otherwise. So take a look at this law. This law is very straightforward and it's not hard, and this is pretty much the whole thing of the section. It says a group health plan or health insurance issuer. Now notice here it says a group health plan, and I underlined where it says group or individual health insurance. So that means there's no exemptions. Certain parts of the law where it was the so-called essential benefits was only for small group, but notice this says group or individual, which means all. And I put in red here, it says shall not discriminate with respect to participation under the plan. So in other words, that actually says they have to have acupuncturists as part of the plan. But more important than that, because obviously they have to have acupuncturists, but they certainly don't have to have us all. They could say, I already have 2 in this area. But it says this, and this is a really important factor for us. It says coverage against any healthcare provider who is acting within the scope of that provider's license or certification under applicable state law. What does that actually state? Real clearly, it says when you are acting under your scope of practice, you cannot be discriminated. So a service they pay to another provider that is within your scope, they have to pay to you. So for those of you who've been in practice long enough, I'm sure you can remember pre-2012, actually probably more 14, where insurance companies would say, we only pay acupuncture when done by a medical doctor. In other words, we will not pay for it when done by an acupuncturist. This law changed all that. That's why insurance is now, if there's an acupuncture benefit, they have to pay an acupuncturist. In fact, that's why the VA now covers it under the Veterans Choice Program. Bottom line is this, the same applies with evaluation and management. Going back to counseling, as part of a patient plan, you may spend significant time counseling that patient. And that counseling is coded under an E&M, and that is within your scope and has to be paid. Now, I do want you to be careful. Let's not get overzealous here. You likely should not be doing that much counseling every visit, at least one that's above 50% or more. Keep in mind that if you're going over a diet with the patient and spending a half an hour every single day, in my humble opinion, if you're doing a half an hour every day, it's not working because they're not getting it. So certainly spending some time here and there makes sense. So during the course of care, several visits with counseling, of course, makes sense. But again, just not each and every time. Could it be argued each and every time? Sure, but it would be unusual, and it means you have to be able to back it up with your documentation. What I want to make sure that there's a good understanding of is this. As an acupuncturist, there is a large scope of practice and many things a patient may come to you with. Let's say, for instance, a patient comes in and says, Doc, I am having a lot of difficulty sleeping, and I'm waking up at night, and you spend time with them going over, what time do you go to bed? When's the last time you have a caffeinated beverage? What type of beverages are you drinking? Is it waking at night to use the restroom? Things of that nature, talking about sleep positions. That certainly may take some time, and that's appropriate for your time as a professional to code for that counseling. What do you document? All the factors you discuss with the patient, what they're going to follow up with. In other words, I'm actually frustrated that acupuncturists don't bill for their time. I think that as a professional, every patient already understands when you spend time with someone that's longer than what was typically expected, there's an expectation of more funds or more fees for that service because of that time. Part of that is counseling. So bear in mind, in your documentation, counseling is coded with an evaluation and management code. So we go back here to the evaluation and management codes. Now notice very conspicuously, each of these codes, 99201 through 205, the very last part of the sentence says physicians typically spend 10 minutes. Now, when you pick this code for the first evaluation, actually time is pretty much irrelevant. But when you're doing counseling, it becomes very relevant because time now is the factor so long as it meets 50%. Now, likely it's not going to happen on a first visit, though it could. It's more than likely on a follow-up. So keep in mind that, let's say a patient comes in, you spend 30 minutes doing some acupuncture, and then you spend, say, a half hour or more doing counseling. What would you bill for that? At the very minimum, could you bill even a 213, even though that's only 15 minutes? Could you potentially go as high as a 215 if you spent 40 minutes or more face-to-face with the counseling? In other words, that visit being dominated. So the end of the day here to think of is make it simple. Billing for counseling is nothing more than billing for your time under your evaluation and management code. And remember, the evaluation and management code, one of the major components is counseling, not to be confused with consultation, but counseling. So in conclusion, you really want to think of, you're a professional. And as a professional, you should bill as a professional member of the healthcare service industry. And coding your services properly is certainly within your right, and it's actually only reasonable, especially as a professional, to be paid for your services. Now, the good news is it is your choice. You can decide when or when you do not wish to code for it. Just make sure that you keep it consistent and appropriate. Your time for counseling is important. And in fact, when you spend more time, I would implore you to make sure that you code for it to be reimbursed for that time. You certainly cannot spend an hour and get paid for 15 minutes. That does not make sense financially. If you were to go on the show Shark Tank and tell them you're going to spend an hour but get paid for 15 minutes, they kick you right off. So I want you to think of, at some point, you do have to look at your practice as a business and take a look at the proper way of coding for your services to make sure you're getting the proper and correct amount of reimbursement for your professional time. Now, this is a lot of information. You'll be able to download and have this information in a printout format, but you're welcome. You'll see on the front of the handout that you'll get from this, my email. You're welcome to send me an email, but please preface the email that you got the information from this webinar so that I'll know to answer your question, because we're a company that does seminars and we also offer a network service. Our seminars are all over the US. Take a look at our website, which is listed there. We'll come to your area and we do a seminar on coding and billing and compliance to make sure your office is succeeding from a financial standpoint. I certainly believe you know how to take care of your patients. I want to make sure you know how you're getting paid for it and to make sure what's appropriate for your state, for your scope. In addition, we offer a day-to-day service we call the network. And what the network is a service where really for a small fee, I become part of your staff. All you have to do once you're a member is give me a call, send me an email, and it's unlimited. I have offices I talk to several times a week because they always have questions on making sure they're coding and billing properly. Our goal from the American Acupuncture Council is to make you successful. In other words, your practice success is as important to us as it is to you because we're your partner. We do your malpractice insurance, we teach seminars, and we do continuing education. And if your practice is not successful, guess what? You're not purchasing any of those services. So what we want to make sure is that you have a successful and really fun, but also a practice that you enjoy and does the things that you want to do with it. So code the things that you do. And remember, counseling can be something that is billable and reasonable as a licensed acupuncturist. Thanks for spending some time with us.